Have you ever wondered how to tackle the Hesi RN Exit V1 exam? Let's dive into the first question. Consider an older client who has just undergone intravenous pyelography. As the nurse, what information would you prioritize to reinforce to this client? Would it be A, to eat a light diet for the rest of the day? B, to rest for the next 24 hours due to the tiring nature of the test preparation? C, to drink at least one 8-ounce glass of fluid every hour during waking hours for the next 2 days? Or D, to measure the urine output for the next day and immediately notify the healthcare provider if it decreases? The correct answer is D. It's vital to monitor urine output after such a procedure, as any decrease could indicate a potential problem. Remember, the key is to monitor urine output after intravenous pyelography. Moving on to the second question, let's talk about accurate indicators of fluid balance. When it comes to altered renal function, it's crucial to keep an eye on the fluid balance. Now, you might be tempted to think that the difference in intake and output, changes in mucous membranes or skin turgor could be the most accurate indicators. But in reality, the most reliable indicator of fluid balance is the weekly weight. Why is that? Well, any significant changes in weight could indicate fluid retention or dehydration, both of which can have severe consequences for a person with altered renal function. Now, let's shift gears a little and delve into the third question about Zollinger-Ellison syndrome. This is a condition where one or more tumors, called gastrinomas, form in the pancreas or in the upper part of the small intestine. These tumors cause the stomach to produce too much acid, leading to peptic ulcers. So, when it comes to managing this syndrome, what's the most crucial information to reinforce with the client? It's not the definition of the syndrome or the average age at diagnosis, or even the treatment options. It's the importance of promptly reporting any findings of peptic ulcers to the healthcare provider. Peptic ulcers, if left untreated, can lead to serious complications such as bleeding, perforation, and obstruction of the stomach or duodenum. In summary, when dealing with altered renal function, remember to monitor the client's weekly weight closely. And for clients diagnosed with Zollinger-Ellison syndrome, stress the importance of promptly reporting findings of peptic ulcers. These key points can make a world of difference in managing these conditions effectively. So, weekly weight and prompt reporting of peptic ulcers are the key takeaways from these questions. But don't worry, we've got plenty more to discuss in the upcoming scenes. So stick around and keep those thinking caps on. Now let's delve into the fourth question about preeclampsia. We're looking at a prima gravida in her 3rd trimester who's been hospitalized. When her blood pressure starts to rise, what should the nurse do first? The correct answer is to have the client turn to the left side. This isn't a random choice, but a strategic move. By turning to the left side, we can improve blood flow to the heart, thus reducing the strain and helping to control the blood pressure. It's a simple yet crucial step in managing preeclampsia. Moving on to the 5th question, we're now dealing with a client in atrial fibrillation, with an atrial heart rate of 250 and a controlled ventricular rate of 75. Among the different symptoms and signs, which one should concern us the most? The correct response is a cold, pale lower leg. This symptom, seemingly unrelated to the heart, is actually a red flag for a potential serious complication, a blood clot. In atrial fibrillation, the heart's upper chambers, the atria, don't contract properly. This can cause blood to pool and possibly form a clot. If such a clot breaks free, it can travel to other parts of the body, including the legs, leading to a cold, pale lower leg due to reduced blood flow. It's a symptom that requires immediate attention to prevent further complications like a stroke. So, in these scenarios, the correct actions are not necessarily the most obvious or directly related to the primary condition. They're steps that consider the overall health of the patient and potential complications. In the case of preeclampsia, turning the client to the left side can help manage her blood pressure. For a client in atrial fibrillation, watching out for a cold, pale lower leg can help catch a potentially life-threatening blood clot early. Note that the correct actions in these situations are turning the client to the left side and monitoring for cold, pale lower legs. Understanding the reasons behind these actions is essential for providing effective care and ensuring patient safety. Finally, let's address the 6th and 7th questions about infective endocarditis and vasectomy. We're delving into some critical areas of patient care here, so let's get started. Focusing on our 6th question, we're dealing with a client who has infective endocarditis. This condition requires constant monitoring, especially when managing it at home. Now, if a nurse observes a fever of 103 degrees Fahrenheit, it's an alarm bell. Why? Well, this high temperature indicates that the antibiotic therapy isn't effectively combating the infection. In this case, the nurse must immediately report this finding to the healthcare provider. It's crucial to address this promptly, as a persistent elevated temperature can lead to complications or indicate the infection is spreading. Moving on to the 7th question, we're looking at a client who has just undergone a vasectomy. Now, here's a key point that must be reinforced by the nurse. Until the healthcare provider has determined that your ejaculate doesn't contain sperm, continue to use another form of contraception. Why is this so important? Because a vasectomy doesn't immediately result in sperm-free ejaculate. It can take several weeks, and sometimes months, for the remaining sperm to be cleared out of the tubes. Until then, there's still a possibility of causing a pregnancy. So, it's critical that patients understand they must continue using another form of contraception until they've been given the all clear. In summary, these 2 questions remind us of the importance of vigilant monitoring in patient care. In the case of infective endocarditis, a fever of 103 degrees Fahrenheit could be a sign of ineffective antibiotic therapy. For post-vasectomy patients, it's crucial to remind them of the need to continue using contraception until the absence of sperm has been confirmed. So, in these cases, the most important points are monitoring for fever in infective endocarditis patients and advising post-vasectomy patients to continue using contraception. To recap, we've covered 7 key questions from the Hesi RN Exit V1 exam. We dived into a variety of topics, from understanding the priority for an older client after intravenous pyelography to identifying the most accurate indicator of fluid balance in a client with altered renal function. We've also touched on the importance of reporting any findings of peptic ulcers in a client diagnosed with Zollinger-Ellison syndrome, and the immediate action to be taken when a prima gravida's blood pressure increases during preeclampsia. We've looked at the cause of concern in a client with atrial fibrillation and the need for immediate reporting of a high fever in a client with infective endocarditis. Lastly, we reinforced the importance of using another form of contraception until sperm absence is confirmed post-vasectomy. And that wraps up our discussion. With careful study and understanding, you can ace the Hesi RN Exit V1 exam. Good luck.